Chronological histological changes after wound infliction 30 minutes to 4 hours. Margination of a polymorph leucocyte in dilated small vessels may occur, a feature which is often completely absent. It is not a reliable sign of antemortem infliction, as leucocyte may congregate for many hours after death, especially in the skin and around aspirated material in the lung. Some extravascular emigration may begin at the end of this period, but a significant number of polymorphs usually delay for hours. Polymorphs tend to appear early in the subcutaneous fat in the upper dermal layer. Basophilic mast cell lost their granules. Fibrin appears in a wound within a few minutes, but this may also occur in postmortem injuries 4 to 12 hours. Leucocyte infiltration is likely to be more definite, still mostly polymorph, but some mononuclear cells as well. A scattered mixed population of lymphocyte and poorly differentiated monocyte appears, usually after 12 hours. Tissue edema and swelling of vascular endothelium appears. In small wounds involving the skin, a start of epithelial regeneration may be seen at the side of the level of the basal layer of epidermis. Leucocytes tend to democrate the 12 to 24 hours. Leucocytes tend to democrate the area of the wound by forming a marginate palisade. The polymorph response decline and macrophage and mononuclear cell population increases from now on. Removal of necrosed tissue begins with macrophage evident and a basophilic tinge to the ground substances. Mitoses are visible in fibroblast from about 15 hours. Epidermis begin to spread across the surface of the scab down the sides of the cut in the wound. 24 to 72 hours. Leucocyte infiltration reaches a peak at about 48 hours. Repair begins concurrently with the many fibroblasts appearing, but rarely before 72 hours. New capillaries then begin to bud from vessels. The vascular infiltrated stroma becoming granulation tissue. 3 to 6 days. Repair is proceeding apace. Collagen begins to form. Giant cell may be visible around necrotic debris and foreign matter. The epidermis is actively growing. If the wound involves the surface in animals, it grows laterally at about 200 mm per day. Hemosiderin becomes stainable from about the 3rd day onwards. If there is a bruise or any bleeding into the wound, it is often not obtained by Pale's reaction until the 5th day, even though some claim it can appear on the 1st day or 2nd day. 10 to 15 days, cellular reactions subside in small wound, vascularity decreases, cell population drops, especially leucocyte. Fibroblasts are most active with the collagen begin lay down. Epidermis thin, flat but no papilla. Ectopics are reformed for many weeks. Elastic fibers are scarce for a long time, less than in adjacent undamaged tissue, 2 weeks to several months, depending upon size and other factors. Consolidation of healing tissue continues. The inflammatory response has vanished unless the wound has become infected. Collagen and elastin increases. The vascular scar is formed, which gradually becomes more dense, and the vascular epithelium remodels. Dermal papillae reappear unless the wound is side and irregular. Skin adnexia do not appear in the scar unless island of viable skin survive within the wound area. Thank you.